Today, we will discuss how to dispose of asthma side effects. Okay? It's an incredibly strong and energizing method that you will learn assuming that you have asthma. In any case, it can likewise be great for individuals that are in pressure, individuals that have roughage fever, individuals who wheeze, individuals who have rest apnea, and even individuals that can't rest. Presently, this depends on this book here called Close Your Mouth, created by teacher Buteyko, and it's known as the Buteyko breathing strategy. Incredibly strong in the event that you have asthma. Presently, before I get into it, I want to give you a little foundation on how this functions basically in light of the fact that it's exceptionally irrational. So you need to sort of see a few fundamentals. So on the off chance that we take a sound, typical individual versus an asthmatic individual, the typical breaths each moment in an ordinary individual is between like 10 and 12 breaths each moment. In any case, an asthmatic is 15 to 20 breaths each moment. Okay? So they're breathing all the more oftentimes. Every breath of a typical individual to the extent that amount of air is around 500 milliliters. Okay? Contrast that with an asthmatic. It's 700 milliliters to 1 liter of air. What's more, in a typical sound individual, the volume of air each moment is around 5 to 6 liters. Contrasted with an asthmatic, it's 10 to 15 liters of air. What's more, that is the volume of air each moment. So you can see an asthmatic is consuming significantly more air than an ordinary, solid individual. Now here is the strange part. CO2 ordinarily viewed as a waste gas, correct? We inhale it out. We attempt to dispose of it. In any case, CO2 is a higher priority than oxygen, okay? Or then again will I say, it's comparably significant, be that as it may. Assuming that you have asthma, it's more significant. Presently, to comprehend the reason why you need to grasp this, it's known as the Bohr impact. The Bohr impact is a perception, I think it was a specialist Bohr, that the limiting of oxygen in your blood, okay, in the hemoglobin, is subject to CO2, carbon dioxide, okay? As such, CO2, it can't be conveyed. It can't go into the blood except if you have sufficient CO2. Presently, that is a really fascinating piece of information that I didn't be aware as of not long ago. Okay, so here's the following piece of the riddle. Breathing a volume of air more prominent than ordinary doesn't build how much oxygen in your blood.
Well, that is one more logical piece of information. So, while you're attempting to inhale more than ordinary, you're not really getting more air into the blood. What's more, the blood is as of now soaked at an immersion rate somewhere in the range of 90 and 98%. So, while you're attempting to take in more air than typical, you are really bringing down the CO2. What's more, recollect that we discussed this. You lower CO2 and afterward the oxygen can't in the blood. What's more, this is the reason when individuals hyperventilate okay. They in reality pass out in light of the fact that they're getting less oxygen. Why? Since they're getting less CO2. So the more air, the less oxygen is conveyed. Okay, so you got that idea, let it hit home on the off chance that it's not soaking in. Watch this part again in light of the fact that it will be significant for this next part. What's more, one minimal side note, when you inhale generally, around 75% of the oxygen that is in the air that you inhale is breathed out while you're relaxing. We should happen to the following part. Okay, so the less CO2 you have, the more the aviation routes are contracted. So, assuming you're an asthmatic and you can't get sufficient air, acknowledge you need more CO2. So CO2, the supposed waste gas, really loosens up your smooth muscle, okay? In your lungs, it loosens up your lungs. It really assists you with relaxing. So, what is the genuine issue with asthma? Overbreathing, okay? What do you regularly find in an asthmatic? They're generally attempting to get more air, right? They're choking. They're continually attempting to get more air. Also, when they over-inhale, they secure the oxygen capacity to tie in the hemoglobin. So it aggravates it. Okay? What's more, this additionally would appear to be legit as well, in the event that you check out it from the perspective of stress. At the point when you're anxious, you're attempting to inhale more. You're attempting to get more air. Right? What's more, where are you breathing from your lungs, your chest? You're breathing like this. And all the excess breathing is securing and closing down your oxygen, and you're utilizing a greater amount of your thoughtful sensory system. It's known as the survival. You're not in a quiet state. This is the method, all right? Furthermore, it's truly straightforward. Rather than breathing quick, you need to begin dialing back your breath, all right? Rather than, attempting to murmur and get more oxygen. Okay, or pant for air, you need to simply begin taking in an exceptionally standard manner and an extremely delicate way through your nose, not your mouth. Okay, what's more, certain individuals find it extremely accommodating to simply put some tape on their mouth when they nod off around evening time so you can begin working on breathing through their nose. So you truly need to get to a state where your breathing is exceptionally quiet. It's exceptionally delicate. Not so, it's recognizable, so regardless of whether you're sitting down attempting to rest, and you can hear yourself breathing, you don't need that. You need to relax, so it's totally tranquil and extremely delicate, exceptionally delicate. So the air that is getting through your nose is incredibly light, and it's emerging through the nose extremely light. You would rather not inhale with your upper chest. You need to zero in on breathing through the stomach. Okay, so you can pull your stomach down. The stomach is innervated by the vagus nerve, which is all parasympathetic nerve control. So the autonomic sensory system is both deliberate and compulsory. At the end of the day, you have some control over your autonomic sensory system through this sort of relaxing. You can remove yourself from this thoughtful overdrive or, on the other hand, survival mode by simply quieting down your breath, zeroing in on the breath getting through your sinuses gradually and delicately, and returning into your sinuses and, as of now, not breathing through your chest, breathing through your stomach. Presently, the principal thing you maintain that should do before you do anything is you need to quantify how long you can pause your breathing. All right, easily. So this is known as the agreeable breath hold time, or CP. Good. Presently, in the event that you can pause your breathing 10s or less, then you have what is happening. Okay. You have extreme asthma, be that as it may, in the event that you can pause your breathing somewhere in the range of 11 and 20s. It's not as serious, yet you will most likely have numerous side effects connected with asthma. In the event that you can pause your breathing somewhere in the range of 21 and 40s, you will have less side effects. Furthermore, on the off chance that you can pause your breathing over 40s without that compelling impulse, you will have positively no side effects connected with asthma. So the side effects of asthma are straightforwardly connected with your capacity to easily pause your breathing. So think about what the objective is to get at this level here. Also, to have the option to keep up with that for something like a half year, to truly ensure that your condition is disappearing. Obviously, we can never say fix, yet we can express it's disappearing. So the inquiry is pausing your breathing the genuine strategy? No, it's simply a pointer or a device that you can use to sort out whether or not you're advancing okay or not. Right, this is the activity here. You're simply effectively dialing your breath back. You're breathing through your nose. You're breathing through your stomach. Furthermore, you are the point at which you're resting around evening time. You're having the air go in leisurely through the sinuses and out through the nose. So, as you screen this CP or agreeable breath hold time, you will see that you will have the option to pause your breathing increasingly long. Furthermore, for each increment of 5 seconds, you're about to feel much improved. So, what's going on with this strategy? It's rising the centralization of CO2 and something different at the point when you inhale incredibly tenderly through your sinuses. You're additionally expanding another exceptionally restorative gas called nitric oxide, which unwinds the sinuses. Okay. Also, you will find when you do this that your sinuses will begin to open up. They will unwind, you will inhale better through your sinuses. Also, when you check this breathing opening time where you're pausing your breathing, I suggest that you simply plug your nose. So that way pausing your breathing is simpler. So basically begin breathing through your nose. Ensure your breathing is extremely delicate and exceptionally quiet. Never hear your breath while you're resting. Make it incredibly quiet. Dial your breath back however much as could be expected in light of the fact that you will permit the CO2 to assist the oxygen with restricting with your hemoglobin, and utilize the stomach to assist you with breathing, not your chest. You might actually put your hand on your chest and your stomach to rehearse that too. Presently, the other truly cool thing about this is that you will find your feeling of anxiety will decisively diminish. Your capacity to rest will enormously improve, and everything associated with that, it will improve too. So I'll put some more data about recordings you can watch to get more information on this too as a connection to the book. Yet, on the off chance that you haven't seen my pressure point massage procedure, on the most proficient method to separate pressure from your body, that would be the following stage. Look at it here.